Hi, I'm Dr. Janjua. I'm a board-certified facial plastic surgeon. Today I will demonstrate my technique for using Belotero, a hyaluronic acid filler in the lip to correct the vertical wrinkles. Belotero is the hyaluronic acid for choice because if there are superficial wrinkles in the lips, Juvederm or Restylane can show sometimes as a bluish discoloration under the skin, and that can be aesthetically unpleasing. Belotero, however, is less likely to have that Tindler's effect. That's the name of that sign, Tindler's effect or Tindler's sign. And also, for the lip injections, we like to use nerve blocks because lips are very sensitive. Using the Amla cream or any other topical anesthetic cream might not be enough. I will demonstrate that technique too. Our patient, if you can see, at rest we do not see any vertical lines. However, when the patient is asked to try to whistle, you will see the vertical lines. Could you please pucker your lips like you're trying to whistle? And you can notice the vertical lines all over, like a purse string appearance. Trying to inject individually in these lines can be tricky and can leave a speed bump-like appearance. It is better to inject in a fanning manner where you go from the lateral aspect, and as you come out you put a little, then you keep going in all directions, and same this way, and you do a carpet underlay technique to bloat out the whole skin, which will smooth out and iron out the wrinkles without making the lips appear big. The lips would appear big if the red part called vermilion was injected. We do not intend to do that. We will do only the border, the vermilion border, to give some definition. I will also do the filtral ridges to give it definition for beauty reasons, and then the white part of the lip, that is the skin. But first we will start with the nerve blocks, including infraorbital nerve blocks superiorly, mental nerve blocks inferiorly, and then direct injections in the oral commissures. Even if you have given the infraorbital nerve blocks and the mental nerve blocks, there's a small area that does not get anesthetized right in the paracommissure area. And it's not covered by those nerve blocks, and also the nasopalatine nerve block. Could you open your mouth, please? We are using some benzocaine ointment to numb up the oral commissure, and the buccogingival sulcus inferiorly on the right, on the left, superiorly. Great, thank you. We'll give it a minute and then we'll go on to the injection with a local anesthetic using lidocaine with epi and buffered with sodium bicarbonate to take away any sting. It is very important to do any markings prior to giving the local anesthetic, as that can distort the area. I usually like to mark the midline in the upper lip and the Cupid's bow definition areas. These are the filtral ridges. I do not need to mark the vertical lines, as we will be doing a fanning technique and not individual injections into the lines. So we'll start first by doing the oral commissure injections. Open a little, please. Thank you. A little pinch. Then the mental nerve block at the second premolar. In the second premolar. And then we go superiorly towards the left infraorbital nerve. And you feel with your other hand to make sure that you're not too far close to the inferior orbital rim. And I always look for any flash of blood that would indicate that I am inside an artery. And lastly, the nasopalatine area directly underneath. In my experience, this area hurts the most. This is immediately below the columella of the nose. And our numbing is complete. We'll give it about 5 minutes to kick in. Our patient has been anesthetized. She needed a little more local anesthetic in few of the areas. That has been done. And then the sensation was checked with a pin prick to confirm that she has adequate anesthesia. And we plan to use Belotero today. Belotero is 1 ml, and I intend to use 27G syringe, and it's 1¼ inch long. As you can see, I started first with the vermilion border, and then I did the skin, same down here, and now I'll go on to the filtral ridges, because you have to be very precise in the filtral ridge area. You can compare the ridge now between the right and the left being flat, and the right has prominence, but not too prominent. You have to be age appropriate in defining the vermilion and the filtral ridges. As you can imagine, symmetry is critical. Borrow your right hand to gently hold it, please. Thank you. This injection in the oral commissure right in this area is critical right in this area is critical to take away the downward turn of the oral commissure or the corner of your mouth, which can give a saddening appearance. We'll do the same thing on the other side and use the remaining in the right upper lip, because I think it could use a little more on the right upper lip. Would you please hold this here? I'll take that, thank you. Just open your mouth a little, please. Thank you. And the one last dot that's left, very small amount, goes right into the sucking pad. I'm going to have you gently hold the whole thing as one unit. Right there. Perfect. That'll make it easier. We'll maintain the pressure for about a couple of minutes to minimize the risk of any bruising, and after that we will wipe off the markers and reassess the vertical wrinkles and the shape of the lips. Now we have completed our injection process, and you can see that immediately after it there's more definition to the lip. I'm going to point out the vermilion border change and the filter ridges that adds definition to the lip. There's not much change at all into the red part, so the lips do not appear unnatural or enhanced. The white skin, which has the vertical lines, is softened and smoother. We will ask the patient to pucker, and it's difficult to pucker after you've had the local anesthetic, but it'll still demonstrate the improvement in the vertical wrinkles. Would you pucker, please? As you can see, because of the anesthetic effect, it's almost a paralysis, but the intensity of those wrinkles has decreased significantly. That should be fine, thank you. And you always have to warn the patient that it might take easily up to 45 minutes for the anesthetic to wear off before the normal functioning of the lip returns.